Doctor, I'm 30 years old, but my doctor has diagnosed me with early endometrial cancer. I don't have any children yet. Does this mean that I will have to remove my uterus and never have children?
First thing is that since because you are 30 only and you wish to show your fertility, I would like to stage the disease first. And if you have got your MRI and the disease is in the early stage, that is stage 1A, when it is confined to the inner layer of uterus alone, that is the endometrium alone, and when there are no other risk factors, after thorough preoperative evaluation, you can as well go for medical treatment, and you have to be on very close follow-up. And if there is any change in the course, then we have to intervene by surgery.
Doctor, they said that I have PCOS according to my scan report. Does this mean that I will get endometrial cancer?
So, as I have mentioned earlier, the patients with polycystic ovarian syndrome, they are at high risk of developing endometrial cancer compared to general population. It doesn't mean that they should necessarily get that endometrial cancer. Only thing is that you have to be, if there is any alteration in your menstrual pattern or in the flow, you need to consult your gynecologist and you should get evaluated.
My mother has endometrial cancer. Does this mean that I will also get endometrial cancer in the future?
In endometrial cancer, one of the risk factors is familial predisposition. So that when you have any family members with endometrial cancer, whether it be your mother or a close relative, your maternal aunt or anyone, you have to be on close follow-up after the age of 40 years. As I have told you, since because the endometrial cancer, the symptoms will develop very early. If there is any alteration in your menstrual pattern, you have to get evaluated.